Hi, Aditya. Welcome to the Big Unlock podcast. Really happy to have you as our guest today. And just a very warm welcome to our listeners as well. We are on season 7 now, 190 plus episodes. So thank you. And it's always really, exciting to meet and get new perspectives and new thoughts from C-suite leaders. Really looking forward to our conversation today. My name is Ritu M. Oberoi. I'm the co-host of the Big Unlock podcast along with Rohit. Rohit is at an event today, so it'll just be me and you. And I'll read out a brief introduction, your brief introduction, and then you
Sure.
can
Yeah.
into
Let's do
detail.
it.
Yeah. So today we are joined by Aditya Bansod, a leader at the forefront of healthcare access, CTO of Luma Tech. Aditya has spent years working with health systems, trying to move beyond AI hype and focus on what actually gets patients in the door and care delivered. His writing and thought leadership challenge a core assumption in healthcare that technology alone changes outcomes. Instead, he focuses on execution, workflow, and the unglamorous but critical last mile of care. So he's been specially vocal about AI needing to do the work and not just talk about it. So we are really excited to have this conversation, dig into where healthcare AI is truly headed and what leaders need to, get right now about AI. So with that, I'll hand it over to Aditya for your introduction. Thank you, Aditya.
Sure. I think that's a better introduction than I could ever do for myself, and it makes me sound very smart, which I am not. But thanks so much for having me on the podcast. Aditya, one of the founders and CTO here at Luma. And I think kind of like the real nugget inside of what you're saying, kind of like very flattering introduction, was the unglamorous part of healthcare, right? Like we're not like what we do at Luma, the problems we aim to solve. We don't do medicine, we don't do science. Our simple job is make it easy for the patient to see their doctor. And
Mhm.
that is just like such a hard part of the healthcare experience that like there's an inordinate and infinite number of things to go solve there. And so that's kind of what we do. That's like the core of what we do. And my job here at Luma is to kind of lead the product development to help our health system partners, our clinic partners, our ambulatory group partners make that easy for their patients so that ultimately they can run better businesses and deliver better care for their patients.
Great. So thank you for that introduction. And yes, it's 2026, and we're definitely going to talk about faxes. So, like you said, lots of moving parts. So, yeah. But to get started, Aditya, usually our listeners, really like to hear an origin story. So that's what we usually start with. And like you said, a lot of clinicians, doctors, and other people with medical degrees come on our show, and then we ask them how they got into tech, and they always have like a really cool or interesting story, like to what led them to it. So yours is kind of the reverse, I think. You were a techie, but then you got into
That's
health.
right.
So, yeah. So tell us a little bit about that and
Yeah,
how.
my path to health technology is you're exactly right. I started from the tech universe and people
Mhm.
sometimes ask me read through like what is your like how would you what's your background like and I kind of describe myself as like the very boring generic Silicon Valley product manager type. Like that's like me in a nutshell. I've worked at, Fortune 5. I started my career at Microsoft, then I went to the Fortune 100. I worked at Adobe, and then I went into venture-backed startups.
Mhm.
And I spent most of my time working on some flavor of enterprise or platform level technologies. And I kind of realized at some point in my career, what was interesting to me was actually being able to, was two things. Number one was being able to build a solution or product where what I like to call all boats rise. So you're not robbing Peter to pay Paul, right? So in healthcare, you do better for your patients. It's actually better health outcomes. It's more revenue for the clinic. It's better jobs for physicians. Like you can actually make everyone's experience better. So number one was find a problem set where all boats can rise. And number
Mhm.
two, and it's a little more personal. It's like I want to be able to explain to my family, like to my mother, like what do I do? So if you look at my time at like Adobe, I was selling embedded systems to Korean set-top box manufacturers to make being able to play movies on their TVs possible. I get it, right? But it's like very like niche. It's very like, very specific. But now like kind of I had the opportunity when I founded Luma to basically say like, hey, it's hard to go see your doctor. Like our
Mhm.
product makes that easier for you. So kind of my origin story, kind of my path into healthcare was really like number one was, can I find a problem set where I can make it better for everybody and I don't have to like steal from A to give to B? And then number two is like, can I explain what I'm doing in plain English? And we had the opportunity in 2015 to found Luma. And so me and two other founders, one's a radiologist and one is kind of our CEO and leads from like kind of the business seat. And
Mhm.
we had the opportunity to found the company together really with that simple purpose, which is let's make it easy to get to see your doctor. And, I think any one of us who've gone and seen the doctor at some point in the last year, it's like, you know what a challenge that can be. It's like you may have access to my chart, a patient pool. You have so many tools available, and it's still
Mhm.
just very hard. Just hard.
Yes. Yes. Absolutely. No, that's a great story. And I think the common thread we hear from a lot of people is that they just wanted to, make lives better and really have an impact on as many people as they could. So that's kind of the refrain, common refrain
Yes,
that leads to a lot of people who work in healthcare tech. So
absolutely.
yeah, so definitely interesting hearing that from you. So let's get started on the questions. And I think my first question is, why isn't healthcare AI delivering what it's promised? And I think in your Fierce Healthcare piece, you frame the problem as execution, not ambition. And you said, uh, AI basically underperforms when it comes to real operations. So what are
Yeah.
your thoughts about that? And how do you think, healthcare CIOs or CTOs can fix that? Or which
Yeah. I mean,
direction should they go to fix that?
absolutely. And I think, we're one of the big pieces we've moved on from is, um, AI tools as co-pilots or assistants to fully
Mhm.
agentic kind of ways of operating with semi-autonomy. And I think the shift is actually going to be, it may be easier in other markets, but that shift is going to be exceptionally hard in healthcare. And
Mhm.
that's sort of where I think we've seen some of the failings of AI solutions to this date, right? Because they operate with a very limited set of connectivity with the existing healthcare infrastructure. So if you think about
Mhm.
like a larger healthcare system, like an IDN, like an integrated delivery network or an academic medical center, or even like a large ambulatory physician group, there's so much connectivity that has to happen when you hand off care from scheduler to MA to nurse to physician to biller to post adjudication to follow up to coming back in for care. Like the amount of connectivity and the amount of tissue inside the health system that exists to do that is kind of it's sort of unbelievable, honestly. And the way that it works is humans are exceptionally good at passing context along. Now, I think you ask most people to say like, no, humans are terrible at that. But I'll tell you one thing, they're better than computers at it. So,
Okay.
um, and so, like, if you and I are working together, like you're a nurse and, maybe I'm a mid-level, like checking in a patient or like an MA, you can tell me in that handoff, you can say like, oh, and the patient's having a little bit of pain in their left leg. So can you get them a wheelchair? Right?
Mhm.
Like when you're bringing them into the exam room. That's like just common human interactions.
Mhm.
Healthcare systems and, especially like, in the world of non-agentic without good tooling, that context really gets lost. Right. And so, just give you a very particular example. We see a whole world of tools out there where it's like, I'm going to use an AI agent to give you a voice call, connect you, and
Yes.
get you scheduled. But
Mhm.
all the little nuances that a human would pick up in that phone call, do those make it into the chart? Do they make it into transportation assistance? Do they connect to the tooling inside the health infrastructure to maybe ask for an interpretive services, that might be required for a patient who's maybe not an English or Spanish speaker?
Mhm.
Until we can get some of that connectivity into the way that the health system operates to pass that context along, I think we're still going to see these like point effectively AI just being another point solution inside the health ecosystem.
I think that's a really valuable perspective because, we're seeing a lot of traction around voice agents right now. But like what you're saying is unless those voice agents really integrate well or have some kind of additional context built in, then they'll still remain a point solution rather than being,
That's right. That's
fully.
right. And I think
Yeah.
one of the things I see, like I get a chance to visit a lot of hospitals and health systems, and like I sit behind the desk with the reg staff or the scheduling staff or the MAs or whatever it is. And the one thing you see a lot is these transparent handoffs of workflows that happen in like Microsoft Teams or via like text message. Like there's all this like kind of unstructured kind of communication happening that
Right.
until we really get to the point where the AI agents can kind of connect those dots too, we'll
Mhm.
we'll see what we're seeing, which is like I can make an outbound dial to make someone connected for colonoscopy prep. But did I
Yes.
really understand that they have trouble getting into the car because they have side pain? Probably
Mhm.
not.
Mm. Got it. Okay. So then, in your recent conversations, you pointed out that healthcare still runs on cutting edge tech and clipboards. So it's like this
Exactly.
real contrast that we see there, especially around intake and documentation, exactly what you're describing right now. So, where do you think AI can make the biggest dent first? Is it ambient? Is it intelligent intake? I mean, you kind of talked about it. You mentioned that the context has
Yeah.
to stay, but which particular piece of it do you think? That's going to work, and how should leaders measure success beyond time saved? Like just saving time is not everything, like exactly what you're pointing out. If you're missing out on that context or not picking up on those nuances, and you say that you've served the patient by responding immediately with a AI voice agent, that's really not overall in the big picture scheme of things, solving anything. So what do you think, should be the approach for CTOs or CIOs to crack that problem?
Yeah, I think a lot of it is like if you look at there's so much money rushing into this that I think CIOs are having a challenge right now rationalizing all the different technologies that are there.
Mm-hmm.
And we can get to that in a second, which is like there's like this Cambrian explosion of like solutions. And I think ambient technology and ambient listening is sort of like maybe like the tip of the spear, right? Because it's sort of one of those things where it's like it's not bad already. It's like actually matured to a point. And it is sort of the thing that's a perfect point solution, right?
Mm-hmm.
Like the doctor can pick it up, put it on their phone, put it on their laptop, and it can be effective, right? Like it doesn't
Yes.
require huge and like the medical ontology is well understood and that sort of stuff. So like I think that's like a good early win for AI. But that's sort of in my mind the 2023, 2024 version of the story. Where
Okay.
the question you're asking me through is really around like, where do we go and what should CIOs and CTOs be thinking about? I
Yes.
think a lot of it is really aligned to workflows. Like what is the workflow you're trying to achieve? And I
Okay.
think one of the challenges that CIOs and CTOs, in talking to a bunch of them, is kind of the rationalization between many systems inside, many vendors inside the health system who will provide these solutions.
Mm-hmm.
Just a really particular example. Let's say you're an academic system, you buy, a Luma type of platform, a messaging type of platform, an intake platform, plus you've got Epic, plus you've got, Blue Prism, or you've got UiPath. You've effectively purchased 8 overlapping Venn diagrams.
Yes.
And the question is going to ultimately be is there's probably a right tool for the right job.
Mm-hmm.
There's a way that they have to talk to each other. And then there's a workflow that you're ultimately trying to achieve, which is the business outcome, right? And so if you like think about, I'll just use colonoscopy because it's like it's always a tough one for a lot of health systems to operate. In order to get a patient in for colonoscopy, there's so much stuff that has to happen, and it's such a high value procedure that even if
Mm-hmm.
you show up for the appointment but you haven't done your prep work, it's effectively a no-show, right? So you
Yes.
have all this stuff around here, and then you may have other documentation you need from somewhere else. So you mentioned briefly, we're going to touch on faxes and clipboards, right?
Yes.
You have all this stuff that you're doing to help automate the patient,
Mhm.
but the patient is one of a handful of inputs into an event happening for the health
I
system.
see. Okay.
So you may have medical records you may need to request from a primary care provider. You may have prior authorization you may need to do. So the workflow around a colonoscopy or an endoscopy or a diabetic foot exam or whatever the procedure is or a nuclear medicine something, you have all these like rivers like leading into the lake, which is the ultimate like health event, like the billable
Yes.
event. And if you're not orchestrating the workflow around that, like I have an AI faxing solution, I have an AI voice solution, I have like an AI, scribing solution, you may
Mm-hmm.
end up having to like actually build an IT and software development shop to put that together. Most CIOs and CTOs I talk to, 99% of them don't want to build a software competency. They want to build a competency around delivering healthcare. But they
Absolutely.
ultimately have to build like an integration competency, which there's a mess where I think in the next 2 to 3 years, you're in this messy middle, right? Where
Mm-hmm.
it's like you'll have multiple solutions that kind of have to, like CIOs are going to have to spend a bunch of time integrating and then rationalize in 2 to 3 years. Kind of final point on this is take our minds back collectively to 2020,
Mm-hmm.
2021. Almost every CIO bought a telehealth platform, bought a texting platform, bought a remote patient monitoring platform because of COVID. And then by
Mm-hmm.
2023, 2024, they were in the middle of a rationalization period to kind of solve out like they had like 45 apps doing 30 jobs. I think
Mm-hmm.
you'll see a very similar thing with healthcare, but really instead of only focus on rationalization, it'll be focused on workflows.
Mm-hmm. But if there isn't a solution out there which does everything and you're still dependent on these point solutions, then how do you get to that platform moment in healthcare AI? Like, how
Well,
does that happen?
I don't think, this will be, I think I'll be the most honest here possible. I don't think that platform exists today.
Right.
And so I think we are still probably 2 to 3 years of R&D and D and software development ahead of us as an
Oh.
industry, not just at Luma, as an
Mm-hmm.
industry to really get to a point where the connectivity
Mm-hmm.
allows for a real platform to emerge. And the way I say this is, Epic's made some good statements around like we're going to support like a workflow application inside of Epic, which will be like agentic. You've got
Mm-hmm.
other vendors that are like saying we'll make MCPs available. Like a
Yes.
really good one that I saw was I think First Data Bank, like the Med database. They
Mm-hmm.
said we're going to make an MCP available so that AI agents can take advantage of that. Well, that's
Mhm.
great. Like I can plug that into Claude. I can plug it into like OpenAI, but that's standalone. How do I make that part of the overall orchestration that
Right.
exists? So I think we just got like 2 to 3 years of actual like just real hardcore software development ahead of us in
Mhm.
order to see what emerges as a real platform and then like common technology that lets us plug these pieces in with an interop angle to it.
So you think even with this plethora of AI tools out there and these advances happening like now every week instead of like literally every month, you still think it's 2 to 3 years out?
Yeah, I mean, I think in terms of having a rationalized answer on how to go solve a problem,
Mhm.
I think we'll see how many, like, I mean, you see this like every week there's a new prior authorization AI
Yeah.
platform, right? You see like literally every week, and another company
Mhm.
have raised $65 million to go solve
Yeah.
the problem, the same problem that's been trying to be solved for 6 years.
Mhm.
So there's just a lot of money and activity chasing a limited number of problems.
Mhm.
And, um, we're all patients, right? Like that's actually one of the beautiful parts of what we do.
Mhm.
And there's a very discrete amount of jobs to be done. So until like if there's like let's say between the moment you want care and the moment you receive care, there's 70 jobs that have to get done, right? If there's a vendor for every one of these sorts of things, no CIO is going to make this work, right? It's just like it's just impossible.
Mhm.
So right now that's kind of the direction we're heading. But very soon, maybe in the next year, you'll see one vendor that handles 10 of those problems, two vendors that handle 30 of those problems. And I think
Mhm.
in 2 to 3 years, you'll see like 2 to 3 vendors that can handle 30 to 40 of those like jobs to be done, which
Mhm.
you'll have like instead of having 70 vendors solve 70 problems, you'll probably end up with 3 to 4 that solve 70 problems. And I think that's the 2 to 3 years that are ahead of us.
I see. Okay, that's a good answer. So let's change track a little bit and talk, about the agentic workflows that you talked about. And you said that,
Sure.
with MCP and with, these protocols that let agents talk to each other. Uh, so we see this kind of paradox or this dichotomy as you if you will between clinicians and doctors and digital health startups we talk to, where people are saying, oh, we want human in the loop, we want peer check, and then also talk about agentic, which is the exact opposite, where the agents have autonomy and they're doing things on their own. So how do you kind of reconcile those two different viewpoints, and where do you think that's headed, and what are
So
the trade-offs?
do you I use this expression to talk. So you have, you're familiar with like Maslow's hierarchy of needs, like food and like shelters at the bottom and self-actualizations at the top.
Mhm.
So jokingly, I'm like every health system has like their AI hierarchy that they're working on. Some
Okay.
are just like, I need ambience. Like I
Mhm.
just need to make my doctor's life easier. And others are at the very top, which is like, I'm going to let the agents have like semi-clinical conversations with patients. Right.
Yeah.
And every health system is sort of in a different spot on this journey.
Mhm.
I'll find like high-end academic systems tend to be the very top, rural healthcare systems tend to be at the bottom, but everyone's kind of converging. They're all heading in a direction. And so I think I myself have been surprised in this hierarchy of needs how fast people are moving up the ranks, right? They're
Exactly. That's what
moving
I'm
up.
saying. Yeah.
Yeah, like I had this wonderful conversation with a CIO friend yesterday. They're
Mhm.
like, yeah, we're letting the AI agents do med rec, right, with patients and like verifying that they're still on these medications. I was like, already? Like that's happening
Yeah.
today? And it
Yeah.
was like kind of one of these eye-opening moments for me. And
Mhm.
then I had like Luma has this product where we help health systems manage their incoming faxes with AI, like order management, kind of like document discovery, like order processing.
Mhm.
And what I thought would happen, and this is one of those areas where I think I was very wrong, was they'd want a human to verify like every document before every order, every
Exactly.
referral.
Yeah.
And they're like, just give us the exceptions. Like we deal with this in rev cycle, which is exception-based work queues, right? Like give us the exceptions and we'll let our humans work with the exceptions. But the stuff where you have like 95% confidence, like let it ride. And so I was like, oh, this is kind of interesting. I think I was the gun shy one. I was the
That's very
hesitant
good.
one in how
Yeah.
this market would evolve.
Mhm.
Because I think what we're seeing is, you see a lot of like it's one of those things in healthcare, and I think you saw this in 2020, which I just bring this up again because I think it's a very interesting parallel,
Mhm.
where what we experience as consumers, like you and I, like we got DoorDash before we got telehealth, we got, FaceTime before we got telehealth. You get all these like different things in our consumer experiences. So you're using OpenAI, you're using Claude, you're connecting your personal health records to OpenAI, right?
Yes.
To ask it like, hey, tell me like I've had this like, I'm feeling bloated. Like, look at my health records and tell me what it could be.
Mhm.
I think we see this thing where it's like, the consumerization of health technology before the health systems adopting it.
Yes.
that's shrinking, right? The amount of time between those things is shrinking because the consumers are demanding it because
Yes.
patients are consumers, consumers are patients.
Mhm.
So I think just to kind of very precisely, I'm being long-winded, but to very precisely answer, like talk to the question, I think health systems are moving towards this moving towards autonomy faster than I would have thought.
Yeah, that definitely seems to be the trend. And like you said, I think it's part of it is normalization as well. When we get to used to, like OpenAI talking to us about health, or we, like you said, consumers are just becoming more comfortable with that idea and they're open to sharing, and it's not such a big deal anymore. So that's actually pretty interesting. So then how do you within Luma, how do you set up these guardrails or audit trails, or escalation logic? Do you have like governance committees, or like how does this thing work? Like who decides how much of the sharing is okay, or how much of it is going to be like human checked or not?
I like to think of it from two sides. Number one is like kind of the governance and audit side. And so
Mhm.
one of the things I've seen that I've been very pleasantly surprised is both ISO, like the International Standards Organization, and High Trust have actually like started to get new policies and new compliance programs into place. So ISO 42001, High Trust R2AI, like we've seen like a good effort from like the compliance and regulatory, like not regulatory, but like, the standards bodies. And so
Yes.
like Luma, because you asked specifically to us, we're working on kind of those sort of regulatory and compliance programs. That's one slice, right? Like making sure you follow best practices and have an auditor say your like stamp seal of approval. The other is you have to build the product to meet this health system where they are on this hierarchy of needs. So if the
Hmm.
health system is like, we haven't even deployed ambient tools yet. Okay, like you're still at your first step. You're still looking for food. You're still looking for shelter. And
Hmm.
some health systems are like, hey, I want to completely reallocate my 500 plus call center team to only work these things. I need you to work the rest of them and answer any question a patient might ask. Okay, so you're at the top of it, like you're looking for self-actualization, self-realization. And so I think you have to build the software once you have the compliance pieces in place to allow different health systems to be a different part of their own journey. Everyone will kind of end up in the same place in 5 to 6 years, right? Or pick a number. But they're not going to all, some will run, some will sprint, some will jog. And as long as you build the software to accommodate, their own path on that journey, I think you'll be in a good place. Just a really particular example using our fax product, we can turn up the knob, we can turn the dial up to 100% automation, or we can say like, hey, if the confidence scores that we get are above 80% or below 80%, have a human look. And some health systems are like 90% is okay. Some health systems are like, 70% is okay. And we'll deal with some errors on the other side. So it really depends where they are. And if you have the tooling to kind of support that journey they're on, I think you allow for a lot of, you allow for that different levels of AI maturity in health systems to be expressed in their workflows.
Okay, great. So you were saying give the control back to, the clients or the health systems and let them decide how much of the autonomy, or how much
Yeah,
human in the loop they want.
our vantage point is we have an opinion, right? We're
Mhm.
not like short of we're not short of any opinions over here. And so, we have
But
standards and
that's
best
what I was
practices.
interested in. That's
Yeah.
what I wanted to know. What's Luma's opinion, or what's your
Yeah,
opinion?
absolutely.
Yeah.
So we say like, hey, if the AI basically thinks it's 90% right,
Hmm.
and we have like LLM as the judge, right?
Yes.
So one LLM runs the process, another LLM judges the output. If the answer is over 90%, we generally say fully automate anything above
Let it
90%.
go.
If
Okay.
it's below 90%, that's our best practice. Now, some health systems are like, I want 70%. We're like, great, we'll turn the knob down. And when you feel comfortable, then next month we'll turn it to 75, then we'll turn it to 80, then we'll turn it to 85, and then we'll get it to 90. I think we're probably a couple months away, maybe 6 to 8 months away from getting to 95%, where we want that to be. But like
That's
our baseline is like, hey, if we're 90% sure, let it ride. Don't even require a human to verify.
okay. Great. That's good to hear. That's optimistic. So that's all.
Hey,
So
I build software. My job is to be optimistic.
yeah. So, Aditya, as usual, time's flown by. We are already at 25 minutes. So we would
Look
love
at
to hear
that.
some, closing thoughts or comments from you. And especially, I think the listeners love to hear about, what your thoughts are for the future. Like if you had a crystal ball, or maybe, 6 months or a year, where do you think you're going to be? And, with AI especially, where is this all heading? And we always get like conflicting answers between the very optimistic folks and the, catastrophic thinkers, like I said yesterday. And one of my
I
last guests called it bimodal thinking, but he said you
yes,
be somewhere in the middle. So what's your take on that? Would love to
I
hear.
like that expression, bimodal thinking. Sometimes I like to say both can be true at the same time.
True.
Like I think just overall we're like, I run, in our organization a very large software development team. And I think like just the very nature of what software development is and product development is it's a radically different field in the last 3 months. And the nature of the job is just going to be very, very different. So that's one set of thinking, which is like I'm a little worried about like what does my profession look like in 5 to 6 years,
Yeah.
maybe in 2 to 3
What does your
months.
team look like? Yeah.
Exactly. On the other side, as where I see this going is I think the ability to help patients get things done has never been better. It's literally never been better because you can actually have a dialogue with an AI agent that lets you talk at 2 in the morning when you have that stomach pain to get scheduled for an urgent care visit at 9 o'clock. Right? Like that, we've never had that ability. We had online scheduling, we've had wait lists, we've had fast pass, we've had all these things. But just being able to actually engage patients in the way that lets you operationalize I think it's up and to the right. I think it's just like completely, we're in for a new frontier in how this sort of stuff happens. And honestly,
Yes.
I think the set of solutions that we're all bringing to the market today, if we look at them 18 months from now, we're going to look at everything we built in Q1 or H1 of 26 as naive. So like I think we're going to see this like just complete different way of actually making it easy for patients to see their doctor. And I think that's just like it's very exciting. I worry about software development on one side. I'm just super excited about what it means for Luma and for healthcare in general on the other side.
Great. Yeah, I think the pace has really accelerated, especially in the last 6 months. The kind,
Absolutely.
yeah, especially with Claude and co-work and everything. It's kind of
100%.
reaching science fiction levels right now with Molt and the agentic community. So interesting.
100%.
Yeah. So thank you so much, Aditya. It's been a pleasure having you on the podcast, and thank you for a great conversation.
I really appreciate it. Looking forward to the next one.
Thank you. Take care. Bye bye.
Cheers.